Well, we'll shift our focus today to talk about the implications of the planned strike by doctors. You know, this also has an economic aspect. Federal government says the ongoing industrial actions by National Association of Resident Doctors is rooted in structural and policy issues within the health sector rather than neglect by the administration. Dr. Ishak Salako, Minister of State for Health and Social Welfare, has stated this on Tuesday in a statement made by Mr. Alaba Balogun, the Director of Information and Public Relations of the ministry. Yes, that is my guest already standing by for me in Abuja for us to have that conversation. Yes, he is a medical doctor, Dr. Agbo Ebuta. Thank you, Dr. Ebuta. It's good to have you on the show, and thanks so much for joining us.
Actually,
Dr. Agbo Ebuta, can you hear me? Good afternoon.
Yes, I can hear you.
Thank you.
Good afternoon, Tolu.
Thank you.
Good to be here. How
yes,
are you?
I'm all right, and compliments of the season.
Same to you. Same to you.
We are worried. We are really worried. People are concerned about resident doctors attempting to ground the healthcare industry in Nigeria. Let me ask you, are they justified, or is the federal government actually meeting their demands in your thoughts?
Well, the thing about whether they are justified and whether the federal government is doing what is necessary, it's something that has to be taken on an issue-based level. Like every issue has to be looked upon and addressed, because they've come up with, there are several topical issues. There are issues about reinstating some workers who were laid off. There are issues about salary arrears. There are issues about professional position, entry level, and a couple of other things. So some of the issues are significantly straightforward and can be dealt with dispatch, but some other issues are quite complex. Like if you'd followed the course of the event and how things have unfolded, only about 4 or 5 weeks ago, they had agreed that they were going to shelve the National Association of Resident Doctors. We're going to come back from a strike and would give the government some time to put together their interventions, reactions to the proposition of NAD. Unfortunately, this is just 5 weeks, and NAD is already saying they are going to go back on strike. And the implication again is that NAD basically comprises of 40% of the Nigerian doctor workforce out there, and they are responsible for more than 50% of the work that is done actively by doctors. So it's going to significantly impact the health sectors. And so at the end of the day, what we should be advocating for is that we should advocate for Nigerians. We need to look for platforms and frameworks that are outside, extreme actions like strike actions that will allow us to keep Nigerians safe. We are all aware of one or two of those security actions or activities that have gone on in a few security challenged areas. And we hear that maybe 40 people have been killed, 60 people have been killed. If we look at the metrics and what happens when doctors are on strike, especially a significant component of the doctors, the National Association of Resident Doctors, 40% of the doctors' workforce. If we look at the fatality rates, that the spike in fatality rate, the number of people die in their tens to thousands. So it's something that has to really critically be analyzed. Some of the issues are things that are basically straightforward. And for example, the number one issue that is being promoted or being projected is the issue of the Lokoja 5. These are our colleagues to a large extent, and the federal government and the National Assembly have intervened. But what is left is just to implement certain things. However, some people at the other end, who are the recipient end of government recommendations, also have a different view of what the conclusion would have been. But be as it may, to a large extent, a resolution has been, a pathway to resolution has been outlined. And two of the 5 Lokoja doctors who were asked who were dismissed have been reinstated, and they've been asked to resume in other facilities. Although NAD is still insisting that they must resume at the Lokoja facility where some of these infractions took place. Now, the contention there is that there are institutions and then there are individuals. Do you sacrifice individuals, sub-institutions over institutional frameworks? Do you weaken institutional frameworks because of certain concerns and certain issues? So these are things that need to be addressed. With respect to the remaining three, two of them have been reinstated. They are just meant to pick up their reinstatement letters, write one or two letters of undertaking and resume. And of course, their arrears will be paid. This may require some financial arithmetics and some advocacy, but at the end of the day, the arrears will be paid. The last group is, I think, one of the doctors who was even absent and did not get the opportunity of a fair hearing. So that particular doctor, for example, would have the opportunity of fair hearing, but the outcome is a fait accompli where that doctor will be fully reinstated. However, it has to do with if the recommendations by the committee set up by Federal Ministry of Health is going to be adopted completely by NAD, and that is where a major challenge is. So it's not as if they have not reached some form of proposed outcome. What the challenge is an acceptance of what has been proposed. When it comes to the financial issues like the arrears and all of those things, to a large extent, it has brought a lot of suffering on some NAD members. But you need to understand that when you want to do appropriations, when you need to assess finance, there are procedures and there may be one or two challenges. The time between the last strike and now is just 5 weeks. And it's not as if one is trying to give an excuse for government. But these 5 weeks also intersects with a period when people were on break. In Lagos, they had Dirty December. In Calabar, they had the Carnival. In Uyo, they had... So all over the countries, people were basically on break. That slowed down the machinery of government. And again, to insist that during this period when people are on break, people are trying to close their book. 2024 budget is closing. We are trying to activate certain aspects of 2025. We are trying to look at 2026. And that during that period where human resource is a bit distracted, human resource is inadequate, you give a very narrow period. In all sincerity, the end user of health facilities who are now going to suffer if we down tools and if doctors are not available, if health workers or health hospitals are not efficiently delivering services, are going to be at the receiving end. It would have been fairer to give more time for some of these interventions to take place. I know a lot of time has been given, but when you say you are back from strike on the 29th of November, and just within the first week of January, when people are just showing back at work, we are also already threatening another strike. I think that is something for us to dispassionately look at. We should be objective. NAD has a position, they're advocating for improvement in health interventions, capacity of the health sector, and that fits into the picture of what the Federal Ministry of Health and Social Welfare is trying to advocate. If you look at their programs, Nigeria is a country of 240 million people. Our doctor to patient ratio is in the region of 1 to 10,000. We have about 55,000 doctors or thereabout. If you look at that, that is just about 13% of the number of doctors we need. We have a doctor deficit of about 85 to 87%. Every year, 9 million Nigerians are giving birth to. We have brothers, sisters, cousins. 9 million of them join our population every year. And if you do the maths, WHO recommends that for every 600 person in your population, you need one doctor additional. So we need to be adding 15,000 doctors every year to the current number of doctors we have. So we do not have that. We are operating less than 15% of the number of doctors we need, and we are allowing situations like this, and we are going on strike. No, I think as a NAD should be able to think outside the box, strategic pressure application interventions that will allow them to achieve their outcomes without the Nigerian populace suffering. Because ethically speaking, one of the first things you swear to Hippocratically is primum non cessare. That means you should first do no harm. Beneficence. You should protect the interest of the client, the patient. So I'm not saying that NAD should not advocate. What I'm saying is that in all of this advocacy should be smartly and strategically applied in such a manner that the Nigerian populace out there with high indices in mortality, morbidity, will not suffer excessively beyond what they are presently suffering.
Now, Doc,
you must give it to Federal Ministry of...
Doc, you make that point as because a very detailed response to my question, I must say. But there are some allegations of alliances between the leadership of the National Association of Resident Doctors, a particular political party, and all of that. But really, my question to you would be: is politics a factor in this strike threat that threatens the well-being of Nigerians, Nigerian workers, and of course the entire citizenry? Go ahead with your submission.
You cannot isolate, we are all political animals in one way or the other. Either you are a card-carrying member, or you are not a card-carrying member, or you are contesting, or you are not contesting. You will have your personal opinions and your leanings, so to speak. So to a large extent, we cannot isolate the impact and the influence of politics in some of the dynamics that we see. But at the ground norm, the general idea, the best approach is that the Nigerian people should not suffer. If we have a bandit strike today in Niger, we'll get a report, 40 people have died. But I guarantee you, if 12,000 doctors, members of the National Association of Resident Doctors, down their tools for 48 hours, the number, mortality and morbidity is something that doesn't make, they don't make their ways into the newspaper. Those numbers are not aggregated and presented. So we don't know. But I assure you that thousands of people will die. So that's the approach. The idea is that you cannot give 4 weeks for an intervention and the resolution of problems that have been there for maybe 2 years. And some of them have been, some of them has received some significant attention from government, from the other side. If you look at some of the requests, so to speak, a lot of them, they are very logical, but you need to allow the key players. If you talk of the redenomination of the Part 1 exams into specialist exams, yes, it is clear that post Part 1, that means the exam that you take before. So there are 3 exams in medical before specializing. You have primaries, you enter a residency program. You have Part 1 when you are done with the first phase of residency and you start practicing. And then you have Part 2 and you become a specialist and you're a consultant. But yes, the argument by NAD, which makes a lot of sense, is that after Part 1, you already start doing a lot of things that are, in quote, specialists, not in quote, that are actually specialist responsibilities, but you still do it under the responsibility, the supervision of a specialist, a senior specialist. So what NAD is advocating for is that you get paid for that. So that is an area that requires significant input by several stakeholders. Implementation has budgetary connotations, proper budgeting, and a few other things. There have been concerns that there's a failure of inclusion of some of these recommendations in the 2026 budget. But the budget has several instruments. You have supplementary budget, you have special interventions by the president and a few other third-party grants from NGOs that can be used to fund several things. But what is important is that even if there is no clear reflection of some of these interventions in the current proposed 2026 budget, it's something that can be incorporated in form of supplementary or a special intervention by the president. So it shouldn't lead to a situation where you allow a bad situation get worse. You allow a bad situation give the appearance of being hijacked for political interest, true or not true, as the case may be. But so in all sincerity, at the center of all of this is that no additional debt should be added to the current mortality indices in Nigeria as a result of strike action. Right, we must find ways to resolve these problems in strategic, in organized, in amicable manners that does not add to our mobility and our mortality. And as once said by someone not too long ago in the Nigerian history, that some activities are not worth the sweat or the blood. Some activities are not worth the blood of a single Nigerian. The sacrifice is too much. Dr.
Agbo Ebuta, thank you so very much, medical practitioner. Interesting chat with you around these issues. We'll stay with it, get all parts as we move on. Thank you so much, and do enjoy the rest of your day.
Thank you. Thanks for having me. You too.